COVID-19 cases and deaths has been disproportionately high, but face masks imported from China were in the news for possible quality problems. What exactly was the story and how did the two sides handle the issue? My exclusive interview coming up with the Chinese ambassador to the country, Mr. Xu Hong. And China has been assisting Italy, one of the hardest hit countries, sending 3 medical teams along with urgently needed supplies. Have these efforts made a difference? I talked to the leader of one of the teams in Milan, Mr. Chen Zhengfang. Welcome to The Point, an opinion show coming to you from Beijing. I'm Li Xin. The Netherlands has reported over 13,600 confirmed cases and over 1,100 deaths as of Wednesday, and a mortality rate as high as 8%. A country on Tuesday decided to extend current restriction measures for another month as confirmed cases and death tolls keep rising. The Chinese government and the private sector have stepped up efforts to assist the country in the fight, but concerns have been raised over the quality of Chinese-made medical supplies, such as face masks, or the intention behind China's apparent goodwill. China has said it is hoped that this isolated incident will not affect the friendly cooperation between the two countries in the fight against the pandemic. So why has the Netherlands been particularly hard hit, and how are obstacles to bilateral cooperation being resolved between China and the country? I'm pleased to be joined via Skype by His Excellency Xu Hong, China's ambassador to the Netherlands. Ambassador Xu, thank you very much for joining us. As I said, death rate and the mortality rate have been particularly high for that country, which has only a population of over 17 million, and over the last 24 hours, over 134 people died because of COVID-19. Why is the Netherlands hit particularly hard? And will it be the next Italy or Spain?
Thank you, Liu Xin. Yes, just like you said, at present the situation of the COVID-19 in the Netherlands is still complicated and serious. And you said the data, the latest data, and the mortality rate is relatively high. But you know, the actual mortality rate is not so high because most patients have not been tested, and the actual number of patients should be much higher than the confirmed cases reported. On March 16th, Prime Minister Rutte addressed the country on television, saying that the epidemic is the biggest crisis the Netherlands has ever faced in the peacetime since the Second World War. It shows the severity of the situation. Some Dutch medical experts believe that the spread of the epidemic will continue for some time, but it's not clear when the peak will occur. Why the situation is so hard for the Netherlands? I think because the Netherlands is an open country, relying on foreign trade. So it's very reluctant to take extreme measures such as shutting down the country. It has to balance all the factors, such as the economic consideration and freedom of the movement, etc. However, as the number of patients continue to increase, the Netherlands is facing greater pressure.
The Dutch government on Tuesday decided to extend the current lockdown or restriction measures until April the 28th. But health authorities said on Wednesday that the flattening of the curve may be starting, so no further actions such as a lockdown are necessary. So how is everyday life going on? How much is everyday life being affected, and how are such measures being implemented on the ground?
Currently, the the Dutch government still believe there is no need to shut down to implement the comprehensive lockdown measures. Of course, with the spread of the COVID-19, the Dutch government awareness and understanding of the epidemic has continued to deepen. Mm-hmm. More stricter measures have been adopted gradually. Now the current measures are called the intelligent lockdown. Mm-hmm. They call the measure as the intelligent lockdown, which means requiring the people to stay at home, work from home, maintain social distance, and closes schools, restaurants, and prohibited all gatherings. This is the current situation. They have already prolonged the measures. Some measures has been extended to the end of April, and some extended to the June. I think the situation is still under control. It's still under control. Many people have to stay at home now.
Mm-hmm. Well, let's talk about the collaboration between China and the Netherlands. You said earlier in a press release that since the outbreak, China and the Netherlands have maintained close communication and good cooperation in fighting the epidemic. Mm-hmm. So what specific work has been carried out between the governments of both sides in terms of sharing expertise or providing medical supplies?
Yes. Since the outbreak of the COVID-19, China has maintained close communication with relevant Dutch governments, Dutch departments, including the Dutch Ministry of Health and the Ministry of Foreign Affairs. At the time when China's epidemic was at its worst, the Dutch royal family, the government, and all walks of life all support China's fight. China is grateful for this. And before the outbreak spreading to the Netherlands, our embassy had shared the treatment guidelines issued by the China's Health Commission with the Netherlands counterparts, and in order to provide a reference and buy time for the Netherlands to prevent the outbreak. After the outbreak in the Netherlands, the State Councillor and Foreign Minister Wang Yi sent a letter to the Dutch Foreign Minister Blok expressing China's willingness to deepen international cooperation with the Netherlands to prevent and control the epidemic and work together to address the global public health challenges. Last month, China held a video conference with the EU countries, including the Netherlands, and the Wuhan Xiehe Hospital, mm-hmm. also video connected with the heads of 14 medical institutions in the Netherlands to share the experiences of China. So some Chinese companies and sister provinces and cities have actively donated medical supplies such as masks and gowns to the Netherlands.
Well, the Dutch Health Ministry said recently that it was forced to recall some 600,000 face masks that were shipped from China due to quality problems. So what exactly was the issue and how was it resolved? Is it resolved already now?
Okay. After the Dutch media reported the news last weekend, the embassy and the Dutch side kept close communication. And Dutch Minister of Medical Care called me personally, and we talked about that issue. He said the Netherlands sincerely thanked China for its strong support and help in fighting the epidemic and the assistance provided to the Netherlands. And he said that the Netherlands is further clarifying the situation about the issue that the masks purchased by the Netherlands from China is not suitable for use by medical staff in ICU. I also told him if necessary, China will assist in conducting investigations in accordance with laws and based on the principle of objectivity and fairness. And we all agree, regardless of the results of the investigation, both China and the Netherlands believe that this isolated incident will not affect the friendly cooperation between the two countries. Now, according to the preliminary investigation by the Chinese authorities, that batch of masks claimed not appropriate for the medical staff in ICU were actually exported as non-medical masks. So this case demonstrated that it's normal to have some problems along the process of international anti-epidemic cooperation. As long as we take a fact-based approach, all problems can be properly resolved.
Yeah. Well, concerning the intention behind China's goodwill and humanitarian gesture, there are also some foreign politicians and China watchers warning about China's potential motivations or intentions behind such a goodwill. As China steps up the help to other countries, there will be expectedly more such accusations. What exactly is behind China's action, and will China's efforts be deterred or discouraged by these noises?
I also noticed there were some noise about the so-called political intention of China's support and assistance to the Western countries. I believe the world is a global village. People are in a community of the shared future in face of a challenge like virus. During the critical period of the epidemic in China, we have received the wide support and help from the other countries. So now, with the domestic epidemic situation under control, China is ready to help other countries. This is normal. This is for the sake of protecting people's health and security, both in China and global. So those accusations of China's so-called geopolitical purposes are really evil motivated. Do they really wish to see China stand by? Some Western media are trying to politicize normal cooperation, claiming China's self-needs help as China's responsibility, or maliciously speculate on the so-called political intention behind China's assistance. All these opinions reflect the dark psychology of some Westerners, as well as their arrogance and their prejudice. They by no means represent the majority of the West. I believe people will know and uphold justice. China is doing what it holds right in spirit of others' remarks. And I believe the Main Street public opinion in the West is welcoming and be grateful to China's help.
Thank you so much, and much appreciated for your work and your opinion. Ambassador Xu Hong, China's ambassador to the Netherlands.